This use case was initiated by the management of the infectious disease unit at Chiba Medical Center. And the management of the infectious disease unit was concerned that not all the physicians follow the new guidelines for antibiotic treatment of uncomplicated gram-negative bacteremia. These guidelines were changed recently to reduce the length of antibiotic treatment to 7 days instead of 14 days before the change of the guidelines. And the management was concerned that many patients are continued on antibiotic treatment more than 7 days, either during hospitalization or as a recommendation after discharge. So they approached Adams Center, first of all, to monitor the data and to see what are the rates of above 7 days of antibiotic treatment for uncomplicated gram-negative bacteremia. And then after assessing the results, we came up with an action item and a specific tool to improve physicians to comply with the new guidelines. So first of all, we used MD-Clone to monitor what the rate of antibiotic therapy, which is above 7 days for uncomplicated gram-negative bacteremia. And to our surprise, almost 40% of the cases of uncomplicated gram-negative bacteremia in the hospital received antibiotic treatment above 7 days, most of them for the entire 14 days period. Then we saw that most of the cases were during hospitalization, and the minority of the patients were as a recommendation to continue antibiotic treatment after discharge. The need to comply with the new recommendation is obvious. It has to do with the length of hospitalization, with the rates of future potential resistance to antibiotic, and to any other complications that can be achieved during prolonged hospitalization. So this was a true concern, and we had to do something about it. And what we provided with Adams Center to the infectious disease unit was to give them a dashboard that shows them online all the patients in the hospital hospitalized with uncomplicated gram-negative bacteremia, followed on a daily basis on their antibiotic duration course. And once they achieve a 7-day course, they have a flag that shows that they completed the recommended antibiotic treatment course, and then we can discontinue the antibiotic. What we're doing now is that we are measuring what are the rates of antibiotic treatment that is above 7 days for uncomplicated gram-negative bacteremia, while using the new dashboard in the infectious disease unit and in the entire departments. And we saw that there is a decrease in the rates of patients who are receiving antibiotics for more than 7 days. We are in the process of monitoring and combining all the data together, really to analyze everything and to see what was the reduction and if it is sufficient. And if not, we will intervene in other ways. We hope that in this case, we will be able, first of all, to comply with the new guidelines, to decrease the length of hospitalizations for patients with uncomplicated gram-negative bacteremia, to improve future potential resistance to antibiotics in those patients, and to reduce the length of stay of those patients in the hospital.